Good morning, ma'am. I am Marcel Dean Diaz, student nurse of Davao Doctors College, and in this video, I will perform adult CPR and AED skills. CPR is a combination of oral resuscitation and external cardiac massage. It is also referred to basic life support. The main components of this are chest compressions, airway, and breathing. Now, let's proceed to demonstration. A woman is found unconscious on a public setting. So the first thing we need to do is to verify scene safety. We do it by checking our right, left, front, back, up, and down for any presence of hazards. And make sure that the woman is lying on a hard surface and a flat surface to give appropriate and adequate chest compressions. So upon checking the area, we confirm it that it is safe, so we must proceed to the next procedure, which is the assessment and activation. Also, we must use gloves since we are going to touch the woman. So the next thing we do is to check for the responsiveness. Ma'am, are you okay? Are you okay? After checking the woman's responsiveness, the woman is found unconscious. So the next thing we do is to shout for help and activate emergency response or send someone to get the AED. Help, help, help! I can't wake the woman up! You in the white shirt, call 911, and you in the green shirt, get the AED on the wall and come back. Next is to check for the woman's pulse and breathing simultaneously. We do it by using our index and middle finger to palpate the carotid pulse of the woman that is near you. This is to avoid being accused by a bystander that you are choking the woman. And make sure that you place your or position your face near the woman's mouth and nose to verify if the woman is breathing. And make sure that your face is facing towards the woman's chest and abdomen to see if there is any sign of breathing such as chest rise. Just like this. And do it in 10 seconds. Place your hand or fingers rather 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. After checking the woman's pulse and breathing, the woman has no pulse and breathing. So the next thing we must do is to start CPR. Next, let's move on to giving high quality compressions. First, hand placement on lower half of sternum. For instance, this is the chest of human body. So hand placement on the lower half of sternum or just between the nipple line. Next is give compressions in no less than 15 seconds and no more than 18 seconds. Since we are giving CPR to adults, we must compress at least 2 inches or 5 inches, 5 centimeters in depth rather. And lastly, allow for complete recoil every chest compression. So, also in giving compression, we must make sure that our elbows are locked to give effective and efficient compressions. And put the heel of your non-dominant hand grasped by your dominant hand. Like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 1. Now, let's move on to giving 2 adults breaths. First is give 2 rescue breaths with a barrier device. So we will make use of this mask as our barrier device. And each breath should be given over 1 second only. And next is allow for visible chest rise during each breath. And lastly, resume compressions in less than 10 seconds. So before giving 2 rescue breaths to the woman, we must do the head tilt, chin up maneuver to allow for airway patency or to give rescue breaths efficiently. And we must also remember that in doing head tilt, chin up maneuver, we must not forget to pinch the nose of the woman. So give 2 rescue breaths every after the cycle. So just like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 1. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 2. Now, let's move on to automated external defibrillator. First is to power on the AED, correctly attach the pads, clear for analysis, clear to safely deliver a shock, then safely deliver a shock. And after that, switch role every 2 minutes or every after 5 cycles, then practice good team dynamics. Now, after 2 cycles of CPR, another rescuer with AED arrives. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 3.
Do not touch the patient.
Do not touch the patient.
Shock advised.
Shock advised.
Stay clear of patient. Deliver shock.
Everybody clear?
Press
Clear.
the orange button now. Shock delivered.
Resume CPR.
Pause.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 4. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 5. Now, after 5 cycles of CPR, check again for the pulse and breathing of the woman. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. The woman has still no breathing and pulse. So start again. After 2 minutes or 5 cycles, switch roles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1. After 6 cycles, the woman is now awake. So first, remove the attached pads. Now, position the patient or the woman in a recovery position by placing the left hand up, the right hand on the left face, the right leg up, then side the patient. Recovery position is necessary to keep the airway open and vomit will drain away or drain without interfering with the woman's breathing. And that's it for adult CPR and AED skills. Thank you for watching, ma'am.